Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can see previous year questions from anatomy and physiology. We can see the questions. First question, from which part of the brain cerebrospinal fluid is secreted? Option A, subarachnoid sinus. Option B, choroid plexus of brain. Option C, venous sinus of the brain. Option D, optic disc. CSF is secreted by choroid plexus of the brain. It is a network of brain capillaries which is present at the lateral ventricles of the brain. So CSF is secreted from the choroid plexus of the brain. Option B is the correct answer. And the next question, amount of oxygen in inspired air is option A 21%, option B 78%, option C 45%, option D 60%. Amount of oxygen in the inspired air is 21%. Same, the concentration of oxygen in the expired air is 16%. And the next question, amount of nitrogen in inspired air is option A 21%, option B 78%, option C 45% and option D 60%. Correct answer is option B, it is 78%. The gas which is found maximum amount in inspired air is nitrogen. Option B is the correct answer, it is 78%. And the next question, pressure of CSF during lying position is options. Option A 10 cm of water, option B 15 cm of water, option C 20 cm of water and option D it is 30 cm of water. Pressure of CSF during lying position. It is option A 10 cm of water. CSF means cerebrospinal fluid. It is secreted from the choroid plexus of brain. A rate of secretion of CSF is 0.5 ml per minute and total volume of CSF in human body is 125 ml and pressure of CSF during sitting position it is 30 cm of water and pressure of CSF during lying position it is 10 cm of water. And the next question, blood clotting factor number 4 is options. Option A stable factor, option B tissue factor, option C calcium, option D labile factor. Clotting factor number 4 is calcium. Option C is the correct answer. There are 13 blood clotting factor in human body and there is no clotting factor for number 6. First option stable factor, it is factor number 7 and option C tissue factor, it is factor number 3 and labile factor is factor number 5. And the next question, longest muscle in the body is option A gluteus maximus, option B sartorius, option C rectus femoris, option D vastus lateralis. Longest muscle is sartorius. Option B is the correct answer. Sartorius is also known as Taylor's muscle. The next question, which structure acts as wire of a telephone in the human body? This is one of the previous year RRB question. Options, option A vein, option B arteries, option C muscles, option D nerves. Structure which acts as a wire of telephone in the human body is nerves. Option D is the correct answer. And the next question, the crista galli is a small crust on which bone? Options, option A maxilla, option B ethmoid, option C mandible, option C frontal. Crista galli is a small crust which is present in the ethmoid bone. And the next question, the innermost layer of meninges is options, option A durameter, option B pyometer, option C arachnoid, option D choroid plexus. The innermost layer of the meninges is pyometer. Okay, option B is the correct answer. There are 3 protective membranes that covers the brain and spinal cord. They are outermost covering is durameter and middle layer is arachnoid matter, and innermost covering of brain and spinal cord is pia matter. Here innermost layer of spinal cord, it is pia matter, option B. And the next question, the brain region which is responsible for coordination of voluntary muscular movements, posture and balance is options. Option A cerebellum, option B central cortex, option C medulla oblongata and option D pons. And the correct answer is option A cerebellum, that is coordination and control of voluntary muscular movements, then posture, balance, everything is the functions of cerebellum. Option A is the correct answer. And the next question, cell most sensitive to hypoxia is options. Option A neurons, option B stem cells, option C liver cells, option D muscles. Hypoxia means decreased oxygen content in the tissue. So the cell most sensitive to hypoxia is neurons. Okay, option A is the correct answer. The next question, damage to the nervous tissue is repaired by which cells of CNS? CNS means central nervous system. Options, option A neuroglial cells, option B axons, option C microglia and option D fibroblast. And the correct answer is it is neuroglial cells. Option A is the correct answer. The next question, the temporalis muscles which helps to close the jaw is attaches to which part of the mandible? Options, option A concave, option B coronoid process, option C mandibular region and option D all of this. And the correct answer is it is coronoid process. Question, the temporalis muscles which will help to close the jaw and it is attached to the mandible by coronoid process. Option B. And the next question, the epithelial tissue which lines the oropharynx. Options, option A transitional epithelium, option B stratified squamous epithelium, option C columnar epithelium and option D squamous epithelium. Epithelial tissue which lines the oropharynx is stratified squamous epithelium. Option B is the correct answer. And the next question, a length of inguinal canal is options, option A 3 cm, option B 4 cm, option D 6 cm and option D 8 cm. Inguinal canal is about 4 cm. Option B is the correct answer. Here we discussed previous year questions from anatomy and physiology. These questions will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle. And the next set of questions from anatomy section we can see in the next video.